Hello everyone. Welcome to Team 2's analysis of the human resources management of Mayo Clinic Health System. Mayo Clinic is a renowned healthcare organization recognized for its commitment to patient care and innovation. In this analysis, we will discuss how Mayo Clinic's current HRM practices are evaluated based on the 5 key principles of meeting HR requirements, recruitment and selection, training and development, geographic dispersion, and support of the firm's overall strategy. We will highlight Mayo Clinic's strengths while recognizing potential gaps and areas that require improvement within their HR framework. Mayo Clinic maintains its high standards in human resources management through meeting and at times exceeding in the standard human resources requirements. This is exemplified through a strong legal compliance, support for international talent, high professional standards in HR procedure, and a commitment to diversity and inclusion. Mayo Clinic's strong legal compliance is exemplified through their participation in the federal E-Verify program, which is used to confirm eligibility of employment for United States workers. All hires require the I-9 form for verification and conduct a virtual appointment with HR representatives for accuracy. Mayo Clinic is also a proactive sponsor of work visas for international employees, as between fiscal years 2020 and 2022, the institution filed over 1,400 labor condition applications for H-1B work visas. Their support for international talent showcases Mayo Clinic strongly considers individuals of all nationalities and backgrounds when in reference to talent acquisitions. Diversity, equity, and inclusion are strong pillars of Mayo Clinic's HR structure, as not only are they an equal opportunity employer, they have established the Office of Belonging. The purpose of this office is to eliminate bias in medicine and science by ensuring all Mayo Clinic services are to be equitable in the access of medical knowledge and addressing any barriers or challenges to patients. The Office of Belonging established strategic goals that comprise of 3 guiding principles. The first, called One Mayo, describes the connection between various groups and locations of the institution. The second principle, called Excellence in Belonging, encourages achieving top results and stimulating projects to promote inclusion in the workplace. Lastly, the principle of Category of One emphasizes Mayo Clinic as a top innovator in both improving global healthcare and an innovator in belonging. Beyond legal compliance, Mayo Clinic further meets HR requirements by requiring degrees for most positions, as well as preferred certifications for HR-related jobs such as Senior Professional in Human Resources and Society for Human Resources Management Certified Professional. Mayo Clinic not only meets the standard HR requirements, but sets a strong example for other organizations. Through its thorough work authorization processes, support for international employees, commitment to equal opportunity, and high internal standards, Mayo Clinic illustrates what a modern, ethical, and inclusive employer should look like.
Hi everyone, my name is Candace Simmons and I will be discussing the recruitment and selection of Mayo Clinic. Mayo Clinic recruitment and selection process is finding candidates internally or externally of the organization. Mayo Clinic prioritizes an inclusive environment and continuously finds ways to improve the recruitment process. Although Mayo Clinic is well structured, there are a few areas that need to be enhanced to attract the best candidates and improve their process. Some of the challenges consist of lack of diversity and inclusion, candidate experience, and technology integration. We have proposed some policies that will improve the weaknesses and gaps. We will start with the candidate experience. Mayo Clinic should simplify and reduce the application hiring process. The hiring process has been perceived lengthy, which has made applicants remove themselves from the process. To improve this, Mayo Clinic can minimize the redundant steps. They should provide a support line for managers and candidates and have consistent and constructive feedback. Next, Mayo Clinic will focus on technology integration. Introducing AI tools to assist resume and ranking and scanning. Creating CRM systems will provide status updates, and creating dashboards will give the applicant the opportunity to see where they are in the process. Although the company focuses on EEO, it is important to make sure all departments are equally diverse. To improve diversity and inclusion in Mayo Clinic, there will be ongoing training for managers to reduce biased opinions to ensure fair treatment. Bias-free screening, like removing names and demographics to choose candidates, will be great because it's based off qualifications. Development with partnerships in minority institutions like LGBTQT and HBCUs to attract more candidates, and monitoring metrics for diversity will make sure the improvements are happening. By enhancing Mayo Clinic recruitment and selection process, this can attract and retain well-rounded workforce for the company and patients.
Training and development. What we know. At Mayo Clinic, we know there are many internships that are offered to prospective applicants, especially students. We also know that job training for new employees is provided, which allows new hires to get situated within the company. Based on the spread of campuses, Mayo Clinic has both in the United States and international. We see this as an industry-leading advantage compared to rival companies such as Johns Hopkins, Northwell Health, and NYU. These companies also have different locations in the United States, yet some are more isolated than others. This key factor helps elevate the training and development of Mayo Clinic. More locations leads to more global company exposure. This can help create a more diverse employee portfolio, which in return can lead to more knowledge from different training and education from all over the world being taught and spread, especially in the medical field. Mayo Clinic is also an accredited school that offers medical level degrees called Mayo Clinic School of Continuous Professional Development. The school provides over 200 plus accredited development courses through their own institution. The courses vary in all aspects of medicine and topics ranging from dermatology to nutrition. These courses offered by Mayo Clinic have a credit system as it is a part of their medical school program. Some courses are designed for people that are both novice and experienced learners in the respective field they are choosing to learn about. These courses are offered in the forms of podcasts, conferences, live courses, journals based on continuing medical education, and online continuing medical education courses. Training and development, analysis, and next steps. From doing an analysis of the training and development being offered by Mayo Clinic, it is a solid program. Hard skills and soft skills are covered in the many courses they offer. Ethics and diversity are covered in these courses as well. Employees are also onboarded and trained when they start a job at the Mayo Clinic for their respective position. Mayo Clinic needs to continue to grow and expand their courses. By opening more campuses, a more diverse workforce can be recruited, which gives them a chance to find more great educators for their programs. On the same note, when expanding, they should also continue to invest in online classes. More revenue can be gained from this because more people can enroll online for a single class and not have to worry about fitting in a physical space. It can also allow for world-class instructors to be hired from across the globe and teach remote. A diverse workforce can help further develop the training and education. Experienced employees and educators will have more knowledge to bring and share. Mayo Clinic needs to make sure they listen and collaborate with these professionals, as this can efficiently advance the education they currently have. This can include up-to-date information being taught and having more availability of subjects and courses that can be offered for teaching. What we noticed from the research is that Mayo Clinic has a lot of classes for aspiring doctors in the younger generation. This is a great way to recruit new employees and expose the younger generation to their company when young prospects become of age to look for a job. Hiring people who have already been trained by Mayo Clinic in the past only makes it easier to train and develop in the future. As this candidate has already been administered coursework from Mayo Clinic, this can save Mayo Clinic money as less training would be required. Based on the information presented to us, we wouldn't be surprised if Mayo Clinic already has documented results of the effects of their training that they are not making public. Whether if they have this data or not, it can be used to see which courses produce the best and worst success rates. This can be a crucial step for them to continue to enhance their training and development programs and modify programs that need it the most.
In this section, I'll be discussing the Mayo Clinic's regional distribution, how this world-renowned institution delivers care across the U.S. and globally. We'll explore its flagship campuses, regional outreach, and partnerships that extend Mayo's reach. The Mayo Clinic Health System is widely recognized and respected network of community-based healthcare facilities, primarily in the upper Midwest of the United States. The flagship and the main hub of Mayo Clinic Health System is located in Rochester, Minnesota. With significant presence in the nearby states around Minnesota, especially Wisconsin and Iowa, Mayo Clinic has a network of community-based hospitals and clinics in over 50 communities, serving rural and regional populations. In the Midwestern region, Mayo Clinic has 16 hospitals, 45 multi-specialty clinics, and one mobile health clinic with employees over 76,000 staff members. While the Mayo Clinic in Rochester, Minnesota is the flagship in the Mayo Clinic health system, there are other flagship locations outside of Midwest, such as Scottsdale, Phoenix, Arizona, and Jacksonville, Florida. Arizona location serves to meet the demand in the southwestern U.S., while the Florida location acts as the hub for patients from Southeast U.S., the Caribbean, and Latin America. Through a network of affiliated hospitals, Mayo Clinic network extends to over 35 states in the U.S., as well as several international locations such as Mexico, Singapore, United Kingdom, and India. By extending Mayo's presence in multiple communities in multiple states and multiple international countries, Mayo Clinic not only broadens access to healthcare for patients, but also employment opportunities.
Mayo Clinic uses several human resource management techniques to deliver high-quality healthcare. Mayo Clinic strategically aligns its human resource practices with its mission to deliver world-class, patient-centered care. Mayo Clinic's HR strategy is rooted in fostering a culture of collaboration, trust, and high performance. By prioritizing teamwork, talent development, and leadership growth, the organization ensures every employee is aligned with its long-term vision and clinical excellence. HR plays a key role in supporting this environment from recruitment and onboarding to training and performance evaluation. Innovation is also a core pillar. In 2018, Mayo Clinic standardized its electronic health record system with Epic across all campuses, enhancing patient access, streamlining provider workflows, and consolidating billing. Additionally, the Mayo Clinic platform leverages artificial intelligence to improve diagnostic accuracy and support data-driven care. On the HR side, AI tools are used to streamline recruitment processes, helping to efficiently identify top candidates. Beyond the technology, Mayo Clinic remains committed to employee well-being through a comprehensive benefits package, including insurance, retirement plans, educational support, and wellness programs. A robust performance management system further supports career growth and aligns individual goals with the organization's mission. In essence, Mayo Clinic's approach to HR is both strategic and human-centered, creating a high-performing workforce that is equipped, empowered, and engaged in delivering exceptional care.
Key takeaways. Human resource management plays a vital role in supporting Mayo Clinic's mission of delivering high-quality healthcare. Strategic recruitment, structured onboarding, and comprehensive training ensures Mayo Clinic attracts and retains highly skilled professionals. Regional presence for Mayo Clinic enhances human resource management goals by promoting workforce diversity and expanding access to qualified talent. Mayo Clinic's emphasis on ongoing education and internal development supports a constant high standard for the patients and employees. Integration of advanced technologies and streamlined human resource management practices at Mayo Clinic provides operational efficiency and alignment across its healthcare network. Human resource management remains essential to sustaining excellence and long-term strategic success for Mayo Clinic.